I just echo the words of the previous speakers. It's always a delight to see you in all ministry or health affairs meetings in the Gambia. This is a Saturday. It could have been a free day for you to do some family issues, but you were able to come in here to join us. So we thank you very much for joining us. The Chief Medical Director, who is very dynamic, under whose leadership this first Banjul International Scientific Surgical Conference is taking place. I know all the passion that he has and all the efforts that he has put in this, and I also thank him for all those efforts, Mr. CMD. Mr. Damien Duffy has just been here for a couple of weeks. I'm sure he is very used to such events in Canada, and maybe he can, when his session comes, say a little bit more about what he does and how things go. I thank Mr. Njai for giving a synopsis, because I was planning to also give a little synopsis, so I don't need to do that, so that we can shorten this a little bit more. But I want to say that this is not going to only serve as a donors' breakfast where we're going to have donors giving money, but also as a press conference. So I'm very delighted to see all these press members who are here, and we thank you all for honoring our invitation to come and show this important event to the whole country, because this event concerns the whole country. So we thank you very much for your presence. Just to put a little perspective on this thing that we're doing, this is the first of its kind in the Gambia. And Mr. Njai has mentioned that people travel abroad all the time. I travel maybe once a year, twice a year to go and attend a conference abroad, which is very expensive. And most of my colleagues here do the same thing. And this is because the medical profession is a profession where you have to continuously be learning. If you want to give your best to the people that you're serving, you have to continuously continue learning. And I think Gambians should realize that they are all part of this process for the doctors. The more the doctors learn, the more updated the doctors are, the better care that they get. And therefore, having a Banjul Annual International Conference would just serve that purpose. Will make us more updated. We'll have doctors from the countries that have been mentioned. We have our own colleagues here, and we will be updated. We will continue learning, and we will give better and better care as we go along. So this is something that is supposed to be the interest of everybody. Normally, when such events are called for, the hall will be very, very full. Now, for medical, unfortunately, in the third world, I'm not only saying in the Gambia, people don't give it that much significance. And that is why we continue to trail behind. And that is why when we called for this donor meeting, a lot of the seats are empty today. But I want to tell all those people who are listening to this program, who are not here, that in other parts of the world, which we think are developed world, if you look at what brings in research and what brings in development in the health service, it is not the governments that are doing it. It is benevolent donors that are doing it. If you go and look at cancer research, you go to UK, in every town, in every, what they call their high streets, you will find a charity shop, a hospital shop, which is donating to the hospitals that are there. Because people know that their health is very important. People know that health is very expensive, and people want to donate to health. And you will be surprised to see some rich people giving significant amount of their money to the health sector to make sure that this health sector goes on. What we are looking for Mr. Njai has mentioned just one of our surgeons who has recently come back, how much, just over a short period of time, how much in technical terms that he has saved the Gambian people by doing operation. And you can multiply that to all the other surgeons that are available here. And to make sure that these people are updated and these people are doing the most current thing in the Gambia, it is not only for government to do that, it is people to do that. We are looking for about 4 million to bring in experts from different countries to be hosted in this beautiful hotel, to sit down and talk about current trends, to talk about our experiences. This is how we're doing it in Gambia. How are you doing it in Canada? How are you doing it in Spain? How can we do it better so that we give our people better care? At the same time, over the 2-3 weeks of that surrounding that time, we're going to be offering also surgeries to people free of charge. And these guests that are coming will be bringing their expertise. They'll be bringing some consumables that we don't normally have here. They'll be bringing some drugs that we don't normally have here. And we are going to work together with them to treat people free of charge. And when they leave, we're going to be able to do those operations even better than we were doing it before. In the other hand, the reason why they're coming also is that don't think that they're not also benefiting. They're also benefiting by sharing, seeing how we're doing things, and they may also learn 1 or 2 things when they go back to their countries on how to do it. That is how the medical fraternity works. And what we're looking for is about 4 million. Let's put it into perspective. It cannot properly even buy a good SUV car. $4 million. And if we put that $4 million in this program today, we are set to save so many lives, make so many lives better, not only today and tomorrow, for years to come. Because if Dr. Cherno Jallow gets a certain skill today from this program, he will transfer it to the people that he's training. If I get a skill, I'm going to transfer it. If Dr. Jaita here, who is a general surgeon, a very qualified general surgeon, also doing very new things that were not being done by Gambians in the country, that he's now doing with endoscopic surgery, with laparoscopic surgery. And not only, if I start naming, I will not name, that's why I don't like naming names sometimes. We have now, 10 years ago, if you were to come to the Gambia 15 years ago, you'll find only 1 or 2 surgeons doing everything. Today, you find surgeons in multiple specialties. We have a surgeon, neurosurgeon. We have some orthopedic surgeons. We have pediatric surgeons. We have urologists. We have general surgeons specializing in different things. We have obstetricians and gynecologists doing amazing things. And that's today. But still, there is a lot of need. So what I am saying is that this program today, if it was for this program, and we are a very serious nation, we probably will not even need this. One very rich man in the Gambia will just stand up and say, okay, I'll postpone buying a car for my son, I'm going to give this. And it can happen. One bank can just say that, look, we're going to take a fraction of our budget and we're going to put this 4 million. No, don't even do this, we're going to do it. So I am imploring, it's for the Gambia, our nation. That is why we are all here, that please let us donate generously towards this. Let us not go away, just like CMD has said, and miss this opportunity to make the lives of Gambians better. Let us, everybody, put in something. The hospitals, we are all struggling, some of us who are in the private hospitals, to get specialists to do, because we have only 1 or 2 specialists of each. They cannot work everywhere. So if we have this done, and we have more and more people coming, the private hospitals will benefit. The pharmaceutical industries will also benefit, because we will be prescribing more things. We'll be bringing in more newer things. So everybody who is here has a stake at this. And I am imploring that we try to work with the organizing committee to make this happen. I am very proud of the organizing committee, and I'll mention some of the names of the organizing committee. We have the chief host of this annual conference will always be the Chief Medical Director of Edward Francis Small Teaching Hospital. That's the chief host. Then we have the chair for the local organizing committee. Mr. Njai mentioned that we did a similar program around, I think it was 2000, and, if I remember, 11 or 12, with the Eurolink. But it was only urology at that time. Now we're bringing it to everybody. Okay, and therefore, it was just natural that urology will take the lead on this. So we have the local organizing committee as the head of urology unit. Then we have the co-host. The Department of Surgery is under Edward Francis Small Teaching Hospital, but this is an annual surgical conference, so they are the co-host, together with the University of the Gambia, because this is an academic endeavor. So we have the University of Gambia also, the provost being a co-host of this program. And we have the Deputy Local Organizing Committee Chair, no other than Dr. Roberts, who is one of the first few surgeons. If you were to count surgeons in the Gambia, 1, 2, 3, 4, 5 with one hand, Dr. Roberts will be part of it. And he has served this country in a very huge way. And he's the Deputy Chief, the Local Organizing Committee Chairman. We have Dr. Lamin Jaite, who is a young, very dynamic surgeon. And he is the deputy of the deputy head of Department of Surgery, and he is the scientific committee lead. He is leading all the scientific discussions that we are going to have in this. He is going to be organizing it and leading it. I mentioned that the co-host chief head of surgery is Dr. Jabang, John Jabang, who is the co-host, and he is a neurosurgeon by profession. I'm mentioning all these names so that Gambians will know that we have qualified professionals now in the Gambia to take the health of the Gambia forward. And all they need is a nudge. All they need is a help so that all of us can benefit from it. So Dr. Jaite, Lamin Jaite. We have as part of the organizing committee, Dr. Keta, who is the head of Ops and Gynae here. We have as part of the organizing committee, Dr. Keba Marena, who is here. I am just hoping that my senility has not made me to forget anybody. We have here one of our very young, dynamic, and growing gynecologist here, who is Dr. Neneba, who is leading the welfare committee. And she always wants to be on the background, but we always want to put her forward so that people will also know that we have these young female doctors, surgeons who are females don't like normally cutting apart from in the kitchen. But Dr. Neneba is a very qualified surgeon, and is a growing surgeon, and she's also part of us. The welfare, she's the one who organized the hotel and everything. And Dr. Cherno Jallo as the fundraising chair. But we have a good team to host a very successful conference. As part of our conference also, we have the support of the ministry, and that is why the permanent secretary is here. We have the support of FAB, and that is why they are part of the logo that we have. And we have the support of this beautiful hotel who have given us this donors breakfast at a very, very, very discounted rate. So we thank them also for giving us this hall. I'm sorry I've taken so much time. I didn't want to take so much time, but I felt that there are some things that we have to talk about. I'm really imploring on everybody. Let us not get out of this hall without getting the money that we need. And even if we have more donations, remember this is an annual conference. We can now be more relaxed and stay in our theaters. I'm sure Dr. Cherno Jallo's hands are itching because he even operates in the weekends. And Dr. Firas is here as part of the organizing committee. I forgot to mention him. He's a gynecologist, very qualified gynecologist, doing amazing things in the country and being part of the people training Gambian doctors. So what we need to do is we raise as much money as possible so that during the next conference, on this day, on this Saturday, some of us will be operating somewhere and saving lives somewhere rather than coming here to look for funds again, and it will be just an automatic thing that we'll be doing every year. I'm sorry for taking so much time. This thing started a bit late, and I thank you very much for your attention throughout this. Thank you.
And give you my heart and talk from my heart. This international conference, not for CMD, not for doctors, for Gambia. This for the first time will happen in Gambia. Please, if we don't succeed in this conference, it will be a big issue for all of us. This conference, when you host a lot of guests, you will have a lot of presentation to increase the skill of our doctors. And in the same time, we are going to do a lot of operation. Our waiting list is too long in the hospital. So this conference, in 2 or 3 days, we can finish all our list. This big achievement for Gambia. Please, I bring my dream to you. Since I entered Gambia 2013, this is my dream. I swear by God. And now I came to you and I put my dream between your hands. I need all of you to support me. Not only me, to support all the committees, all the organizers for this conference. Conference, we need to put the name of Gambia in the conferences in the world, in the maps of conferences. Now we send letter to many organizations in the world to register this conference. And maybe if we cannot do it this year, but next year, this conference will register in the world that Banjul International Conference will be every year. This big achievement for the FAB Foundation of Office of the First Lady, for the Ministry of Health, for the Edward Francis Small Teaching Hospital and the administration. I think it's big achievement for all of us. We need your support. We need your help. This issue is not easy, not cheap. To host this conference is very expensive. You are going to have a lot of consultants. They will come to do operation. They need a lot of consumables. They need a lot of medication to do the operation. If you come to the hospital, you see our waiting list is too long, and our doctor will explain now about our waiting list. If we can finish all the operation in 2-3 days, we can do a lot of operation. It will be good for us. When you donate some money, I promise you will not lose this money. Maybe very soon, I don't hope that one or your family need operation. It's not necessary for him to go outside. We can do the operation here in Gambia. So you are not going to lose any delicacy. When you help us to have this conference every year, and when you help us to host any surgical conference, it's good for all the Gambian. This really big dream for all of us. When I discussed this issue for the first time with Dr. Ja, he gave me his full support. He agreed, he support. Really, all of us, we need also to thank Dr. Abu Bakr Ja for his support. He accept directly, he agree with me, and he say it's very good achievement and good dream for all of us. And not only Dr. Ja, all the members of the committees under this organizing, who organized this conference. We have big dream for Gambia. We bring our dream between your hands. I promise you, I promise the Gambian, I will do my best. I will work 24 hours, 7 days every week to improve this hospital to be the best in West Africa. This is my promise, inshallah. 2023, 2024, you will see a lot of achievement when you come and help and support. Maybe in the end of next year, 2024, no patient, no Gambian patient to go outside Gambia to do any operation. I promise you, inshallah. And really, we need to work together. Private sectors is very important to work with him. We thank all the private sector, private hospital they attend. I saw AfricMed and Medicare and Sharab, of course, and MK Clinic. All of us, we need to work together. We need to improve the health sector. Also, in the end, I don't want to take a lot from your time, but please, I appeal to you to help me, help the team, help the committees of this international conference. Don't let us frustrated from the first conference. We need to go ahead every year. We make it annual. Banjul International Surgical Scientific Conference will be in the sky, and put the name of Gambia high between the world. We are not less than any country in West Africa. Please, everybody should know Gambia is not less than Senegal. Gambia is not less than Ghana. We have very qualified doctors. Only they need us to support them. We have a lot of consultants and qualified Gambian, and sometimes we have some foreigners, and they help us a lot. So we are together, we can do a lot of achievement. Ministry, under the support of Honorable Minister, PS, please, we need to thank you again. Thank Honorable Minister for his support. I know if he has time or if he is in the country, he will attend, but please, through you, we need to send big thanks to Honorable Minister for his support, and we need to invite him to share and join us in this conference and do some operation. Please, from now, we need you to promise us that Honorable Minister will attend this conference, and maybe he can start with the first operation in this conference, inshallah. I hope that. Thank you for present. We are very proud of him as the first maybe consultant general surgeon, Dr. Samate. Please, all of us, we need to respect this man. Really, he is very qualified. Always I say, I am here in Gambia since 10 years. Now the health sector is different. I don't want to talk on behalf of the government. I am not political man, but really I need to be honest. And I want to say the truth. Now the health sector is better than before. 2013, 14, we have a lot of problem. I was CMD that time for 3 years, 13, 14, 15. We have a lot of problem that time with oxygen, with consumable, with medication. And always, I discussed with the minister. That time, Honorable Minister was the head of the surgical department in the hospital. And we always discuss about the problem. Now, alhamdulillah, we don't have any problem with oxygen. We don't have any problem with medication. Since I become CND, I am very proud. We don't cancel any operation, and everybody know in this hall, we don't cancel any operation, alhamdulillah. We don't have any problem with medication, consumable, anesthetic drugs. We try to provide this issue. We are today, we need to celebrate that our conference will succeed when you support, and when you donate, you will not lose your money. Maybe one of your family or escort need any operation, and we can do it here. You will be very proud that one day you support the hospital management, you support this conference to be true. So please, again and again, this our dream. We put our dream between your hands, and please let us support our dream to be true on the ground. Thank you, everybody. Thank you so much.